Good morning. My topic today is stereopsis in young adults and its association with different types of tropias and phorias. Introduction. Strabismus is one of the major known risk factors for amblyopia. However, apart from amblyopia, it can lead to various other ocular complications such as loss of binocularity and depth perception. Stereopsis starts to develop at the age of 6 to 8 months of age and is completely developed by 5 to 7 years of age. Stereopsis is a major defect seen in most patients with different kinds of tropias and phorias. And as we don't assess stereopsis on a regular basis during our OPDs, a lot of defective stereopsis tends to be missed on a regular examinations. This present study was done on young adult population to assess the stereopsis, and which can also be of help for further to decide career choices in their future. Implications of the study. An important aspect of strabismus is to know its prevalence in people, as manifest squint, especially esotropia, tend to seek medical help due to the discomfort. However, those with latent squint tend to remain undiagnosed. This can have detrimental effect in their stereopsis, leading to problems with the career choices in the future. Coming to materials and methods, this was a cross-sectional study conducted in a tertiary hospital in South India over a period of 1.5 years. The study included all subjects in the age group of 18 to 30 years. These subjects underwent a detailed ophthalmic evaluation, and the degree of squint, if present, was recorded and was correlated with the amount of stereopsis, which was assessed using the Randot stereo test. The presence of squint and its severity was assessed by cover-uncover test and by prism bar cover test. Results, a total of 132 females and 116 males were included in the study. The minimum age included in the study was 18 years and the maximum age was 29 years. Amongst these patients, 40.3% of the patients were found to have exophoria, whereas 27% of the patients were found to have esophoria, and we had 15% of the patients without any prevalence of any strabismus. On cover-uncover test, as we can see, there is statistically significant relationship between esophoria and exotropia and stereopsis. Patients with esophoria and exotropia were found to have a more defective stereopsis as compared to the other groups. In this, we also compared the severity of stereopsis, and patients with stereopsis 10 to 20 PD or greater were found to have a defective stereopsis for 20 PD or greater for distance were found to have a defective stereopsis, whereas there was no statistically significant difference between the amount of stereopsis for amount of squint for near and the stereopsis. Discussion. As stated in the study conducted by Hashemi et al., 1 out of every 10 adult had some or the other type of phoria. In our study, we found a majority of the subjects had some degree of phoria present. However, greater number of who had an altered stereopsis. This goes to show that people who have latent squint can also have a defective stereopsis. This further highlights the importance of having stereopsis to be measured in a daily OPD basis. A few professions such as surgeons, specifically microsurgeons, pilots, goldsmiths, all of these professions require an excellent stereopsis. However, people with defective stereopsis, especially in these branches, tend to have difficulties in their workplace and find it difficult to cope with the lack of skill. This can have a detrimental effect on the people and can also lead to multiple job changes and can affect their social status. However, upon timely and correct diagnosis of stereopsis, the stereopsis can be improved with the help of perceptual learning, as it's stated by Jean Ding et al. In his study. Conclusion: despite marked advances in ophthalmology and clinical screening methods in the past 2 decades, strabismus is still a major risk factor for amblyopia in students. In addition to the loss of binocularity and depth perception, strabismus has a negative impact on quality of life and individual aspects of life because of its cosmetic consequences. Stereopsis should be included as a part of the routine ophthalmic examinations, as many of times a defective stereopsis or a latent squint is missed and can lead to significant discomfort for people at workplace and in some of the regular day-to-day activities. Thank you.
Yes,
so there are other ways. Do you think lack of stereopsis really affects day-to-day activities? How many people with strabismus would really come to you with a complaint of not being able to perform some activity because of lack of stereopsis?
Ma'am, actually we conducted this study amongst our interns and our co-PGs, ma'am, and we also found that the people with a reduced stereopsis were finding it difficult especially ENT and ophthalmic surgeons, ma'am. They were finding it significantly difficult in their...
So your study population was...
No, ma'am. It was conducted mainly amongst us surgeons, ma'am.
Okay.
We found that the surgeons were finding it difficult to catch up with the steps of our surgery.
Definitely for surgeons, yes, that would be a case. But I thought you were.
Yes, ma'am. And there was another study conducted in Turkey, ma'am, in 2022, which suggested that a lot of people with latent squint had problems in their workplaces, ma'am, and those included mostly pilots and Air Force officers who were finding it difficult because of the defective stereopsis.
Yeah, I mean...
Ma'am, in the pilot initial testing, ma'am, we don't actually test for stereopsis as regularly, ma'am, especially for commercial pilots for joining the job. They don't test the stereopsis. They are tested for, Air Force people are tested for stereopsis, ma'am. But pilots' regular examination does not include stereopsis, detailed stereopsis testing.
See, when I look at this particular study, I mean, there is nothing new in this, okay? The data which you have shown, the way of statistical representation, like mean and standard deviation plus minus, the two extreme values, that could have been even more robust. Third thing is, as you said, that is not coming up. What are the representative samples, like pilot or doctors? And then the study gives the impression that we should go ahead first with stereopsis and then look for phorias or tropias. But it's other way around, right? Yes. When we do a systematic examination, we by default do every patient cover and uncover test, right? So it's the other way of telling stereopsis is more important than the doing cover test and then detecting.
I think her point was it should be used as a screening tool, which can be used by anybody. But an expert examination will require an expert.
Yeah, so that has to come out into your take-home messages and all. So yeah, and then you should also.
Ma'am.
Yeah.
And you didn't have an intermittent
questionnaires.
exotropia? There was no intermittent exotropia?
Ma'am, because it was a cross-sectional study, ma'am. So at the time of presentation, there was nobody, no person in my sample who presented, who had a complaint of intermittent exotropia.
That is quite surprising. Yeah.
That's very surprising.
Anyway, that's good. Thank you.
Thank you, sir.